Good morning. Myself, Dr. Ritu, Assistant Professor of Ops and Gynae Department, and now today we will discuss about a broad topic of Ops and Gynae, dysfunctional uterine. Dysfunctional uterine bleeding is a condition where there is a abnormal uterine bleeding without any pathological manifestation in genital tract and does not have a non-organic cause. It means in abnormal menstruation cycle, irregular irregular uterine bleeding that occurs in the absence of recognizable pelvic pathology, general medical disease, or pregnancy. It reflects a disruption in the normal cyclic pattern of ovulatory hormone stimulation to the endometrial lining. And now come to the incidence. Incidence 40% out of 1000. It is usually common in adolescents and women approaching menopause. And 20% of cases occur in adolescent females, and as many as 50% of women aged 40 to 50 years experience dysfunctional uterine bleeding. And now come to the classification of dysfunctional uterine bleeding. This is two types: primary dysfunctional uterine bleeding and secondary uterine bleeding. And primary uterine bleeding is there is no detectable disease in the genital tract or elsewhere in the body. It is due to dysfunction in the menstruation or ovarian cycle or uterine ovarian pituitary hypothalamic axis. And come to the secondary dysfunctional uterine bleeding. Disorder outside the genital tract, cause of uterine bleeding like hypothyroidism, intrauterine contraceptive device, hormones for contraception, or other use. Etiology of primary dysfunctional uterine bleeding. First, anovulation, lack of ovulation, pituitary cancer, hypothalamic disorder. In case of adolescent, dysfunctional uterine bleeding can happen because they often do not ovulate as their pituitary ovary axis mature. In case of premenopausal women, it can happen due to irregular ovulation because of their decreasing ovarian hormone production. And ischemia and cell death. Etiology of secondary dysfunctional uterine bleeding. Hormones, low dose progesterone, underdevelopment of spiral arterioles. Spiral arteries are small arteries which temporarily supply blood to the endometrium of the uterus. And during the luteal phase of menstrual cycle, example, the luteal phase begins after ovulation. It lasts about 14 days and ends just before a menstruation period. And last dose of progesterone produce superficial dilated veins with atrophy of endometrium. Intrauterine contraceptive device. Because of intrauterine contraceptive device, ulceration of endometrium happens. Bleeding disorder, thrombocytopenia, फैक्टर 2, 5, 7 और 10 डेफिशिएंसी, जो कोगुलेशन फैक्टर हैं ब्लड के, उसमें उस 2, 5, 7 एंड 10 की डेफिशिएंसी. Hypothyroidism, डायरेक्ट इफेक्ट ऑफ थायरोक्सिन, थायरोक्सिन हार्मोन की वजह से hypothyroidism problem. And come to the pathophysiology. Due to alteration in hypothalamic pituitary axis, and because of this corpus luteum not formed, and then failure of cyclic secretion of progesterone, and continuous unopposed production of estrogen, and stimulate overgrowth of endometrium, and then endometrium grows thick, outgrown in blood supply, and necrosis and irregular bleeding. Now we talk about normal menstruation cycle. Mean cycle length 28 days. At age 40 it goes to 20 to 27 days, and less than 20 it means abnormal, and more than 27 days, sorry, more than 35 days it means abnormal. Normal menstruation cycle duration 2 to 7 days, it means normal menstruation cycle. Less than 2 it means abnormal, or more than 7 days it means abnormal. Excess more than 8 days and longer, it excess bleeding or menstruation blood loss, 40 ml normal, and more than 80 ml it's abnormal menstruation cycle. Then we talk clinical features: breast tenderness, nausea, and urinary frequency, fatigue, excessive vaginal bleeding with severe pain or cramping, excessive vaginal bleeding with passage of tissue, weight gain because of polycystic ovarian syndrome, adolescent and teenage, and ovulation immature of hypothalamus. Adult ovulatory in adults, ovulatory rule out PID, pelvic inflammatory disease, fibroid, complications of pregnancy. Premenopausal and ovulatory rule out fibroid, C of cervix and endometrium, cancer of cervix and endometrium. Regular cyclic, ovulatory for short duration, rule out fibroid and pelvic inflammatory disease. Irregular or acyclic, and then anovulatory, rule out CA cervix and endometrium. Diagnosis. Now, intermittent, intermenstruation, ovulatory, fall in estrogen secretion, following ovulation, rule out fibroid and cervical carcinoma. Diagnosis. Now, history, age, fertility, occupation, amount, duration, and pattern of bleeding, associated gynecological problem, dysmenorrhea, difficulty during menstruation, infertility or menopausal symptoms, and bleeding disorder or thyroid dysfunction, contraception, hysterectomy, social and personal background, abnormal and pelvic examinations, and physical assessment we do in diagnosis purpose. Investigation. Hysteroscopy, human chorionic gonadotrophic HCG. We investigate HCG. Complete blood count CBC करेंगे इन्वेस्टिगेशन में. Pap smear test is a procedure to test for cervical cancer in women. Endometrial sampling, thyroid function and prolactin. इन इन्वेस्टिगेशन में थायराइड फंक्शन में प्रोलैक्टिन की इन्वेस्टिगेशन करेंगे. लीवर फंक्शन टेस्ट, कोगुलेशन स्टडी and factor 2, 5, 7, 10 deficiency if they are present. Other hormone assess as indicated. Now management. Hot cold applications for temporary relief from पेन को रिलीफ करने के लिए हम कोल्ड एंड हॉट के एप्लीकेशन अप्लाई करेंगे. बेड रेस्ट, proper nutrition, if there any anemia present, any other nutrients deficiency found, then we do proper management. Oral iron therapy. Treatment of secondary disease, if present secondary disease, then we do proper management. Nursing management. Encourage patient to complete the medication to reduce discomfort and pain. Explain importance of iron-rich foods to supplement iron. If there is anemia present, then give iron-rich foods to supplement. Explain method of quantify blood loss and reporting to healthcare provider. Assess in and teach patient pain relieving techniques to promote self-sufficiency in managing pain. Encourage patient to express their feeling to increase understanding or individual coping style. And then we stop the topic now.